welcome to the last 48-hour webinar series, a free session covering listening, reading, writing, and speaking. We are delighted that you're able to join us. So let's make the most of this hour, and hopefully we're able to clear some of your doubts. Our global panel of TESOL qualified trainers will provide you with the insights and valuable tips. Hello and welcome. I'm Daljit Rao, the CEO of Pear Academy and Dysgu English. It gives me great pleasure to announce the arrival of Dysgu English. Our objective is to help you through your journey of achieving your desired goals. That is to pass OET and prepare yourself for working in the country of your choice. Thank you and good afternoon to all the viewers in India and all over the world. I'm delighted to today welcome you to the last 48-hour webinar. Allow me to introduce myself, Daljit Rao, the CEO of Pear Academy and Dysgu English. Today's session, the panel will be Mercy Pushparaj, who will give you a very brief glimpse of why OET and the test day overview. Listening will be done by my colleague Colin David. Mercy Pushparaj will take over the reading, and I myself will cover the writing component, and speaking will again go back to Colin David with conclusion for the event. Before we move on, for any of you who are wishing to ask questions, please do not hesitate to come onto the chat and we will respond to all your messages or all your queries, because there's a large number of you who are viewing in to our session this afternoon. Thank you and all the best for the session.
Thank you. We'll move on. Just give me a second. Yeah. So a lot of you would be taking the test on Saturday. For those of you who are looking at OET and deciding if you should take OET, that's for you. Why choose OET? Because it's profession specific and it is the only English qualifying exam that's specific to medical professionals and is very relatable for you because it's in your area of expertise and the healthcare environment. It's the only test where the content is related to your healthcare practice. And it also enables you, the test and the practice enables you to understand the health system outside of India. And you also get exposure to a lot of case notes that's similar to the ones set in the UK, Australia, or any other English-speaking country that you're wanting to go to. And OET, I'm very happy to say, is off late recognized and endorsed by a lot of health associations globally. And the content of the exam, you'd be happy to know, focuses on patient care and communication, something that mirrors what you do in your everyday work life, right? And it is definitely a ticket to success and fulfilling your dreams. And that would be the first step for you in your journey to either fly abroad to work or study. Now, that is an overview of the exam format. It is an exam that has 4 modules. You're tested in areas of listening, the reading, writing, and speaking. So it begins with the listening, like you see on my screen. The listening exam goes on for 40 minutes. The listening, reading, and writing is in a classroom, an exam format, and the speaking is an interview format. So coming back to listening is for 40 minutes. It has listening part A, B, and C. We will look at the skills that are important in detail as we go forward in this 1 hour. And the next module is reading. which is 60 minutes. It has reading part A, which is for 15 minutes, and reading parts B and C combined for 45 minutes. Following that, the last of the LRW, the in exam room format, is the writing, which goes on for 45 minutes. Out of this, your 5 minutes is an only reading time, and you get 40 minutes to write your letter. That's what it's required of you in the writing module. The last one is the speaking, that goes on for 21 minutes. It's an interview format, and the speaking exam consists of 2 role plays, for which you're given 3 minutes of preparation time, and the role play, the actual performance of the role play, is for 5 minutes. So that is a brief format of the OET exam. And what you would be expected to do on the test day, or what happens on the test day, I'd like to run you through that. It will be helpful for those of you who are sitting on the Saturday. Okay, please do bring your original ID, the one that matches with the one you've registered while you logged in for OET, and all your belongings, your mobile phones, your keys, money, basically empty pockets. So all your belongings will be cloaked for the entire duration of the test, and following which your ID will be checked via a portal, and a photo registration happens to verify your identity. Following that, you wait at a post lounge, a post registered area, where announcements would be made to you about test rules, about when you would be ushered into your exam rooms, that is the LRW room. So also on that note, it is easier for us and for you when you actually follow the instructions given to you by the test day staff. And I mentioned that earlier, the morning session of LRW runs from 9 a.m. to 12 p.m. And the afternoon sessions, that's an individual session, begins from 12:45 and goes on up to 5:30. You will be having your slots of 21 to 24 minutes. All right, so quickly we've reached there, and I'm very happy to pass it over to Colin for listening.
Thank you very much. If you can let me, I don't know if you can see me. My video says it's not on. I hope you can hear me.
Yeah.
Okay, all right. Listening in the OET is divided into 3 segments: listening part A, listening part B, and listening part C. Naturally, we're going to start with listening part A for 2 reasons. First of all, because it's the first one, and second of all, because it is a unique OET test taking experience. You won't have done anything like this if you've taken another kind of English language test. You're listening for the detail, the main idea, and the gist. For every single question, you get a single mark. You'll be listening to 2 recordings. Each of the recordings lasts between 4 and 5 minutes, and both of them are professional. The context is a professional context, typically between a patient and a consultant, a patient and a doctor, that kind of situation. And you'll be listening along to identify specific information. And with that specific information, you'll be completing a set of case notes. Okay, so you're not filling in it's not like an entire transcript. You are listening to the whole thing, but you're not reading a transcript of the whole thing and just filling in the gaps. There's a bit more to it than that, and I'm going to explain. So next slide, please. Okay, so before we look at an example, listening part A is, as I said, it's a note form gap fill activity. You're not going to be reading every single word and then just waiting for the missing word to go in the gap. Okay, so please pay attention and listen for the information that the patient is providing. Okay, so it's set up by let's say, the doctor, but the information's coming from the patient, almost always coming from the patient. Based on that, you'll then complete the notes based on what you hear. Okay. The patient's going to talk about their condition, and that might be, for example, recent symptoms, family history, it could be test results, but that information is coming from the patient. And a couple of tips for you. You need to think about the type of information that is missing. So you'll be set up, and they do this on purpose. They set it up so that you can kind of anticipate what sort of information you're going to be listening for. Okay, so there is context, and that's there to help you. It's designed that way. Make it work to your advantage. You're going to be keeping your ears open for those keyword or keywords, and those will help you to follow along with that dialogue. It is a dialogue. You'll be hearing the doctor, for example, you'll be hearing the patient, and there is an interaction between the two. And something to bear in mind is synonyms, words which mean the same or almost the same as the word that you can actually hear. This is how it's a language test. Do you as a candidate know that word X means about the same as word Y or word Z? All right, next slide. You might want to take a screenshot. You'll be seeing these little stars in the corner of your screen from time to time, where if we have a slide which is going to be interesting for you for self-study after this class, you might find handy. So this is a screenshot moment, and we'll move on by looking at an example. This is an element of listening part A, and in a moment you're going to be hearing the interaction between doctor and patient, and you'll be providing us, hopefully in the Q&A, by all means, we'd love to hear your answers in the Q&A, to the information that is missing. What we've highlighted here before you actually listen are words where we want you to draw your attention. Okay, notice the gap for number 1 is followed by the word sensation, as is the gap after number 3, followed by the word sensation. So you're going to be listening for a word that's connected to sensation, let's say probably an adjective. Notice one's related to the abdomen, the other to urination. And then in gap 2, we got the idea of pain. These are words which are there to guide you, guide your ears, guide your mind to being in the right place. So I'm going to be quiet. What I'd like you to do is to pay attention and fill in the information that is missing in gaps 1, 2, and 3.
Have you been to this medical practice before, Lisa?
I have, yes. Probably about 3 months ago.
Okay, that's good. It means that you're in our system. So, what brings you in today?
I think I may have a bladder infection. I've got a sort of feeling in my lower belly, a sort of cramping. It's like there's a heavy pressure near my bladder. It's hard to describe. I also have some pain around here in my lower back.
Right.
It's kind of like period pain, but I finished my last period about 2 weeks ago, so I don't think it's related to that. That was on the 16th. The main thing is it feels like I have to pee every few minutes. I always seem to have the feeling that I need to go. There's also a bit of a burning sensation when I do go, so that kind of makes me not want to put it off, if you know what I mean.
Yes.
The pain isn't too severe, but it's enough to make it uncomfortable.
Okay, two nicely spoken voice actors there. And thank you very much for those of you who are sharing your answers in the chat box. You've done pretty well. Let's have a look. What have we got? Number 1 is cramping. Well done to those who got it. A cramping sensation in the lower abdomen. In space 2, the answer is lower back, some pain in the lower back. And then space 3 is burning sensation. It's interesting, if you reflect on it, if we're talking about a sensation on urination, I can't think of many other sensations that would be described upon urination other than burning. So that's why your experience, your knowledge of English and your knowledge of medical language is going to help you when you're doing this, okay? Anticipate what you think you might hear. It will help you a great deal. Okay, next slide. Listening part B. Listening part B is a much more traditional style of test. Listening part B invites you to identify the main detail or idea of what you're hearing. As before, you have for every question 1 single mark, and you'll be listening to 6 workplace interactions. These could be short dialogues, they could be short monologues, but all of them will take place in a healthcare setting. Another reason why we think that the OET is an interesting choice, a positive choice for somebody from the healthcare professions, is You're not listening to recordings about things in which you have no interest or no experience. This is not the case. In part B, it's going to be a healthcare setting again. All right. So in each of the 6 elements of listening part B, you have 3 option multiple choice questions to choose from. Okay, it's going to be A, B, or C. Next. The scenarios that you'll be listening to expand on that workplace context could be anything like a handover on the ward, a safety briefing, or maybe a staff briefing. It could be feedback on training, maybe an incident report, a conversation between healthcare professionals, or perhaps a conversation or some kind of address to a patient. In every single case, it will be familiar and comfortable to you. Okay? So, a few hints for you. I sense that there's a little star coming up on the screen for a screenshot, but before we do, let's talk about these hints for listening part B. It is really important that you understand what the question is asking you to do. What does that mean? You need to be familiar with the purpose and with the language of the extracts. Part of the job is done. You're a healthcare professional, and these are healthcare listening tasks. Next. Try and focus on the meaning of the extract. What is the extract? What are the people in the extract actually talking about? Use the very little time that you have to underline the words which give an indication of what it is that you're actually listening to. Okay, this will all help you. Next. Listen for the support details, the all-important question words: how, what, when, where, and why. All right. Again, anything that you've got that's in your arsenal to help you answer the question, so much the better for you. These are useful hints. If you want to take a screenshot, you've got 3 seconds. And then we're going to move on to the next slide. Okay, we're going to look at our example for listening part B. Okay, the setup is this. You're going to hear 2 nurses talking about a patient on their ward. 3 things that I don't want you to forget while you're listening to this relatively short extract. Listening part B extracts are around about 40-45 seconds. Your aim is to identify the main idea, to identify the purpose, and to identify the course of action. Okay? So we're going to listen in a moment. Take a few seconds to read the setup. They agree that the patient is. Have a little look at that. A, B, and C. And we're going to listen in about 5 seconds.
Mr. Lee just threw a spoon at me.
A spoon? Why?
He hasn't stopped moaning about me all shift, so I told him to stop. That's when he threw the spoon.
Did it hit you?
No, he's harmless, but that's not the point. He just won't let up. He's fine with other staff, but everything I do seems to be wrong. Apparently, I wrapped his bandage too tight, and he even moaned that I didn't close the curtains properly.
Honestly, it does sound like he's singling you out a little. That's hardly fair.
No, it's not, is it?
I know. Let's ask if you can swap patients with me.
Really? I'd be glad to if you don't mind. I'm sure it's just me he's taken against. I don't want to go back into his room ever again.
I'll give him a few minutes, then I'll go in and try to talk to him.
We've all experienced patients like that, have we not? A, B, or C? Let's look at the next slide. Little hint for you. What is the topic? Remember, I asked you to think about that. Topic here is a disgruntled patient. All right. And what's the gist of this conversation? Gist is this patient is being particularly difficult. The female voice is sounding a little exasperated. Okay. That being the case, let's see what the answer is. It's not A, because it's not about him being entitled to complain. There's nothing about that. It is not any threat to safety. She's not feeling threatened and she's not complaining about that. So it has to be C, because, yeah, he's being unreasonable. The nurse tells a colleague that he's fine with other staff, but everything that she does seems to be wrong. So she's trying her hardest. He's not cooperating. As I said, we've all experienced patients like that, no doubt. Okay. And let's move on to listening part C. Again, a little bit in the same way as listening part B, it is a form of listening test, an English listening test that you will have experienced before if you've never done the OET before. It's a comprehensive presentation. It's kind of long, 2 recordings of 4 or 5 minutes. It might be a lecture, a presentation, it could be a talk, or perhaps an interview with a healthcare professional. And again, familiar topic, something that it may be directly relevant to what you do, okay? It may not be, but it's in your comfort zone. You won't feel, oh, I've got no idea what this is. What you're being tested on is your ability to follow, to comprehend, and identify the speaker's attitude. What is fact and what is opinion? You are answering here a total of 12 questions. There are 2 extracts in listening part C. So remember, it's 6 multiple choice questions, and each of those has 4 answer options, not 3 as in listening part B. In part C, you're being assessed on your ability to follow a fairly lengthy presentation, or it could also be an interview. Some people prefer the interviews because you got the setup by the interviewer. Other people, makes no difference. Again, it's worthwhile being comfortable with both. Listen for the speaker's attitude towards an aspect of the overall topic, and please listen out for those prompts. Okay, in an interview, the prompts will come from the interviewer. In a lecture, they're going to use what we call signpost language which sets up the movement of the topic from one point to the next point, and of course using your powers of your listening powers, your English powers, to infer and to think about, to consider synonyms and synonymous language. Okay, we're going to be looking at an example. Okay, have a little read of that. I'm going to be quiet for a few seconds, maybe 15, 20 seconds. The important word in the question here is surprises. What surprises Jennifer? So have a read. This is the setup for listening part C.
Hi everyone, my name's Jennifer Seaver. I'm a clinical nurse educator and I'm here today to talk about something very familiar to us all. It's a routine that can potentially save numerous lives and one that we've all been taught since we were toddlers: hand hygiene. This is described by many healthcare workers as possibly the single most important tool in preventing the development of healthcare-associated infections between patients. Infections such as Staphylococcus aureus, Clostridium difficile, MRSA, and gram-negative bacteria. Most hospitals have strict policies and guidelines that we must all abide by. So if it's so important, why do we continue to see such an underutilisation of such a basic practice? Why don't we follow the procedures that should already be ingrained? This, unfortunately, has proven difficult to determine. Let's first put things into perspective with new data from the Centres for Disease Control and Prevention.
So, A, B, or C? What surprises Jennifer? And again, do share your answers. It is B. Thank you. The attitude surprises her of many healthcare staff towards the issue of hand hygiene routines. Okay, so the quote from what Jennifer said, quote, "So if it's so important, why do we continue to see such an underutilization of such a basic practice?" I think it was Semmelweis in Vienna who discovered the hand hygiene thing. But there you go. Jennifer was surprised by that. All right, B. Well done if you got the right answer. Hats off to you. let's move on. A few hints for you. Please try and identify the purpose and the language that you're going to be hearing in the extracts. That will help you give a grounding. Try and recognize the context sentence. That's going to give you a bit of background information and set you up for what it is that you are listening for in your answer. Get it in your head that there is a difference between your opinion about something and your attitude. All right, subtle but important. You're listening out for the main point. Now that's going to help you to get rid of what is a tempting answer, but what we might call a false, an intentional false one there to tempt you in to get the wrong answer. So again, eliminate things that are definitely wrong and narrow your field down from 4 to 3 to 2, and then choose the right answer. And then use the question stem to guide you. So that means you've got to listen out for that main detail, and that's going to help you to identify ultimately what will be the correct answer. I sense we have a blue star coming. Yes, we do. Take a screenshot, my friends. Okay. A little review then of listening parts A, B, and C. A few tips and traps for you. Please, overall, listen for the keyword in the question stem. Number 2, try and understand that there are synonyms and there is inference language. All of the stuff is in there to help guide you to the right answer. Quickly get to the gist of the topics in parts A and B. In part C, please try and get your head around, understand the speaker's attitude. Stay a few steps ahead of the speaker means that you're kind of trying to anticipate the direction of the conversation. Believe me, they're not going to go off in a direction you did not anticipate. That's not the way they're designed. There's another little star. Take your screenshot of our tips and traps. Okay. Oh, yeah. Okay, done the screenshot. That's fine. Let's do the quiz. Take a few seconds, please, to answer these 2 multiple choice questions about the OET listening. Which skills are being tested in listening parts A and B? And which of the following is not being tested in listening part C? Let's see if you were paying attention and have a look at the answers. It is A. Which skills are being tested in listening parts A and B? It is A. Identify key information and main idea. Well done for getting that one right. And in fact, in the second question, the answer is B. Which of the following is not being tested in listening part C? It is comparing options thoughtfully. The other 2 are in fact true. B is not part of your strategy for listening part C. Okay. There you go. Unstill is something we'll talk about to you very, very soon, but that's a very exciting thing coming up on the horizon. We'll give you more information as we get it, but that's going to be a very exciting development. Next, we're moving to reading, and it's Mercy again. Welcome back, Mercy. I'll see you again soon.
Thank you, Colin. Hi, everyone. So like I mentioned before, this is the second module in your morning slot. That's listening and then reading. Reading, also similar to listening, has 3 parts, which is reading part A, the first one, that's for 15 minutes, and B and C together for 45 minutes. So reading part A, we start with. Here you get a total of 20 questions to answer. Each question carries 1 mark each, 15 minutes. And the type of questions are matching questions, where we look at an example, you'll get to understand it better, where you are given four different passages, and you're expected to match which passage your question belongs to. And then you have short answers and then sentence completion or note completion. Here, the correct spelling is important, and look for keywords. Looking for key information is the key to reading part A. And your primary skill here is to be able to skim and scan the document. You may be getting extracts or texts of medical guidelines, treatment pathways, drug information, or medicine tables. So out of this, how you are able to look at headings, how you're able to look at subheadings. And remember that you will not have the time and you do not read the whole extract. Okay, the idea here is to look at key information. And the activities, like I mentioned, are matching, where you skim and read the text to find out which one contains the information, and you write A, B, C, or D in the gap that is provided. You have short answers where you scan through the text and you find out for specific information, could be a number, could be the name of something. So you scan through and find for specific information. And the third kind is sentence completion, where you scan the text and find for words that, and you spell it in correctly and put it into the gaps. Okay, that's A. This, I've already mentioned this. This is example of the text that could be included as part of your reading part A test, which could be a dosage, a procedure chart, a recommendation, or any patient information of a particular condition. Okay, so that is an example for reading part A. You can have a look at it. And following are the questions. So you, like I said before, you see the question says, for each question, decide which text, that is A, B, C, or D. This is only a slice, a sample. So you just have 3 texts here. So from which of these does your information that is asked for in the question comes from? You could key in your answers as we are looking at it. It could take a while, maybe 15 to 20 seconds to read it, go through it, and then key in your answers. While you do that, look at also the second one, a word or short phrase from one of the texts. Yeah, quite a few of you have got the correct answer. So let's just look at it. Before that, could you look at how we go towards while we look for the answer in your question stem, like we did in listening? Underline what you are to look for. The internal structure, we've underlined that for you. We've highlighted it for you rather. And the second one is symptoms. So compare that to where you could find that information. You skim it. Your structure is like you see visually in the first text, and the symptoms is given to you in the second one. And the third one is about numbers. It's about the statistics. So if your question is related to that, you would put C in your column. Right, and the second one is we've highlighted highest number of deaths. So you would see the number of deaths, you'd see the number, you'd see highest. So that's your cue. Let's look at the answers. Yeah, some of you have got it right in the chat box. Thank you for that. And yeah, so the internal structure, like you see, is indicated by the picture, and that's A. The symptoms you see are in B, and the short answer, and hats off to those of you who've got it right. A lot of you have. So the number of deaths, so the number is highlighted in part C, if you look at that, and the highest one is what was asked of you. All right, that was part A for you. And yeah, before we move on to part A, I'd also like to tell you that part B, sorry. Part A is something that is very timed. So your challenge is managing the timed pressure. So it is very important that you quickly look at the extract and look for information, because this is also about testing. If you're able to look at the layout, if you're able to look at the headings, if you're able to extract the information that you require, which you'd be doing many times, you'd be doing that in your workplace. Okay, moving on with reading part B. Reading part B again is consists of 6 questions, 6 extracts, and 1 question for each extract, and 1 mark for each question. Here for B and C combined, you have a total of 45 minutes. Ignore what says on the screen. It says 40 minutes. No, it's 45 minutes. And these are basically extracts that are focused on workplace communication. And the task here would be to identify the main idea or the purpose of why is this extract there? What is expected of you what does this extract convey to you? That is the purpose of part B. And here the details are very important. And here you recognize the main message. Also, why, what, and how of the whole extract. That's about part B. And these extracts could be policy documents, could be manuals, could be pre-operating procedure, a workplace related memo. These are things that you come across, and how much in detail will you be able to read them is what part B is all about. And here you'd have multiple choice questions with 3 options, right? Yeah, quickly some tips for part B. Understand what the question is asking you to do. Look for keywords in the question. What from the extract is the question about, and what the question wants you to do? Is it identify? Is it list? What is the question about? Familiarize yourself with the purpose and language of the extract. Look for synonymous languages and look for what is the purpose of the whole extract. Do you see there's a lot of similarity in the skills and the tips that you require in reading and in listening? So you'll be able to make that comparison by now. And focus on the meaning of the extract. A detailed reading is what will allow you to focus on the meaning of the extract. All right, time for a screenshot so that it'll come in handy for you. Right, moving on, I think is an example. Yes, it is. So just take a minute to read through this, and the cue is also, it says main idea or purpose. So read with that in that direction, please. A lot of you have started putting in the answers, though. Okay, we look at the answer. Okay, going back to a tip before we look at the answer is also, we said, look at what the question is asking you to do and what the question wants you to pick out, and then also look at synonymous language that will help you find the right answer. So here the question, the extract is about the guidelines. That's another thing to underline for you. Radiotherapy simulation planning appointment. And the question is about what the guidelines informs you to do. So your keywords are those, what it informs you, and then you look at your options. Yeah, so the answer is that the guidelines, informs us about the equipment. And what about the equipment is it about that it improves precision, and the synonymous language is accurate. So if you're able to pick that language, and that is why also, do not skim and scan here. Don't carry in your reading part A skill here. Please read in detail, and do not assume, using your medical knowledge, do not assume that this could be how the passage goes. Read until the end, until you get the answer using the synonymous language and picking up detail. Okay, good to those of you who've got it. Congratulations. And moving on. Yeah, that is about reading part C. It's combined, like I mentioned, with reading part B. It is for 45 minutes. Here, this is the factor that differentiates part C from A and B is also that it is a wider reading that is required. It is, a lot of you would come across more than your everyday workplace communication. You'd also read a lot about the developments or upgrades that are happening in your profession. The extracts in part C are more towards that side. It's about studies, articles, or any findings. Okay, so here the skill is to assess how are you able to recognize attitudes and opinions from two comprehensive texts. Texts that talk about facts, texts that talk also about findings, about opinions. Go back to listening C. The skills would be very similar. Okay, here you would be presented with two texts of 800 words each, and you would have 8 multiple choice questions with 4 options each. Okay, that's reading part C. Yeah, like I said, you will be required to differentiate between facts and opinions here. Facts are based on research, like you know, and can be verified and are not open to debate, while the task requires you to look at different points of view. And here, an individual's opinion may be presented to you in an article, and that is what you would be expected to pick most of the time. And you can differentiate between fact and opinion by paying close attention to the language used by the author. That is why picking on underlining important words, understanding synonymous language is important, because that will give you the lead into if it's a fact or if it's an opinion. Yeah, tips for you for reading part C. Understand again what the question is asking you to do. I think that is standard for all the tasks that will help you to find the answer. Familiarize yourself with the purpose and language of the extract. Recognize the writer's message or opinion and what they are trying to communicate. Do not get carried away with forming your opinion. That is a mistake that a lot of candidates do. Go with picking what is the writer's opinion or the message that the writer is trying to convey. And the focus is on your ability to recognize opinions, attitude, and the main point of the passage. Right? Time for a screenshot for those of you who'd like to keep that for tips. Okay. Yeah, that's a sample of an extract for you. It's only a sample. So take a minute to look at the sample and the question that's following. Okay, so before we go into the answer, another tip is that usually when you look at C, read the extract in detail first. Sometimes when you look at the options, it could confuse you. So get the main idea of the extract, get the details of the extract, and then look at the question. Some of you have got the answer. Congratulations. Yeah, so to highlight, your question is about what the writer claims. He claims that medical marijuana is beneficial in which areas or which medical areas of concern. So yeah, so that's highlighted for you there, that can decrease, that his studies have shown that it can decrease nausea caused by chemotherapy, and it can eliminate vomiting. And you have an option there. Also sometimes, yeah, I hope some of you have got that right. Hats off to you. To give you an example on that note, sometimes you may be confused with the answers. So what you do is similar to what Colin had said while explaining about the listening part C, eliminate the answers that you don't think are very close to the extract. And maybe you'll be able to funnel down and find an answer that's closer. some tips and traps. Understand the question stem. That's again similar to a lot of the modules. Understand what the question is asking you to do. Develop a good base of synonymous language that will help you so that you don't miss out on the answer. And your ability to skim and scan and understand the main idea of the text. You could take a screenshot of that. A tiny quiz for you. Take a few seconds and answer that. Reading part A, B, and C, and what it asks you to do on the right side. Okay. Yeah, the answers. Yes, as we discussed, I hope you all were listening. Yes, a couple of you have got that right. So reading part A is about skimming and scanning. Part B is gist and purpose. And part C is about getting the author's attitude or opinion. All right. A quick thing about, we've spoken about choosing OET, and why choose Dysgu English? Because we are premium preparation providers and we boast of a pass rate of 95%. And all our coaches, all of us, are TESOL certified globally and in India. And very importantly, we will be able to contextualize the whole understanding of the Western healthcare system, like beginning with the principle of the known to unknown, from contextualize it to your working environment and move on to how it works in the Western healthcare system. And a lot of social and cultural integration along with working along the case notes. And progressive feedbacks help you to understand where you stand, what is your level of skill, and how much you need to work further. And I'm sure the tips and traps will help you to crack the OET. And I hope you've got a sample of that today. Right, over to Ma'am Daljit for writing.
Thank you, Mercy, very much for a comprehensive reading segment. Let's now move on to the writing. Writing can be quite challenging for many. So let's first have a look at the glimpse of what is expected in the exam. The word count has to be 200. The case note is presented in profession specific. So if you're a dentist, it'll be in your line of profession, the case note. Likewise, medicine, nursing, physiotherapy, etc. You will be given 5 minutes of reading time and 40 minutes of writing. You will write either a letter of referral, transfer, or a discharge letter. And so what is very important in the letter is that how you are structuring the letter so that the reader is able to understand at a glimpse of what you're trying to say. Let's move on now. So you'll be given a case note. We've just put up a case note in front of you. And quite often the mistake people make, you're very, very experienced in your field, in your professions. But what the case note is doing is it's migrating you to the Western world. So the setup is all based on what happens in the healthcare system in the UK, in Australia, in a Western community of health. And so before you move on in extracting the right information, what you need to understand is what exactly are you going to take out of that case note and how do you identify the setting of healthcare system? And I'm going to refer you to the Australian healthcare system. I've got some photos, very quick one. On my left-hand side of the screen is an aeroplane that goes, which is called the Royal Flying Doctor Services, and that goes and covers all the regions of Australia because Australia is quite large. Now, in the aircraft, you will always have a nurse, and either the pilot is a nurse or a doctor. So there's always a doctor and a nurse accompanying because they could be performing surgeries. So in your case note, You need to understand the relevance of when they say there was an emergency and the patient was flown in. The patient is flown in by the Royal Flying Doctor Services into the emergency section of the hospital. Okay, then you've got the ambulance that's on the right-hand side. That's what the ambulance looks like, very well equipped electronically as well, and the nurse or the doctor, whoever's in there, depending on what type of ambulances we have, they will have the report ready for you as soon as the ambulance gets into the emergency of the hospital. Next. Now, a very common case note that comes out for nurses particularly is the nursing home, where the patient or your client who is being transferred from the nursing home to the hospital. Let me define what is a nursing home. It's for elderly who cannot take care of themselves and they are needing full-time care in an environment where they feel very much at home because they've got their own room with a bit of their furniture to make them feel comfortable. And so this is where you will always have its respite care for the elderly. Then there is those who actually don't need the full-time care, but would like to move out of their homes and go into what is called a residential village. Now, this is where you will have care, a night nurse or a physio coming in and doing some of those services, but you are fully independent. So understanding the background of what is a residential home, what is a nursing home, what does a Royal Flying Doctor Service is all about. And then there's another one that's called the district community nurse, and they visit homes to service, to do, either they will do your blood pressure check or they will do your bloods, anything that a patient cannot perform by him or herself. Next. So now let's look at the case note. You will, and the structure of the letter. How do you format the letter? And what we usually say is when you come through the center to be trained, we say to you, look, first start off with structuring in 5 paragraphs. And those 5 paragraphs are very easy. If you think of ISBA, if you think of SOAP, which I understand most of you guys would be using in your environment here, because it's very common in Australia or UK, you will be identifying in the first paragraph, what is the purpose? Why are you writing that letter? All the W's in the first paragraph. In the body of the letter goes, you will comprise that with situation, the assessment of the patient, and the background of the patient. So just imagine for a moment that the patient has now been admitted in the emergency department. You are then identifying the patient, what has happened, and then you've admitted the patient. You will now tell us in the body of the letter what happened in the hospital, all the scenarios, the background, the situation, the assessment, and the recovery. And in the last paragraph is the recommendation. What are you recommending when the patient is discharged from your hospital or from your surgery, day surgery? Okay, so in the beginning of the letter, it's tell me why are you writing? And in the middle body of the letter, what exactly has happened? And at the conclusion of the letter, what is it that you want that specialist or that nursing home care to provide for that patient when they discharge? Next, Mercy. So to give you an idea of how quickly you can identify the information, and in the exam, it's in that first 5 minutes is what we ask you. Read first the task. Go back to where this is written, as in, where exactly is it? Is it in a hospital? Is it in a daycare surgery? And then read what the relevant case notes that needs to be identified. When you're looking at this case note, you can see that about 65 to 70% of the information is relevant. The rest, yes, it is relevant, but it is not for the task that they're asking you. So what we say to you is the easiest way is identify them in 5 numbers. Number 1, purpose. Number 2, 3, 4 is for the body, which is the background, the assessment, and what exactly is happening with that patient. Okay. And number 5 is the recommendation. So you can clearly see on the screen how we have highlighted the relevant by numbering them, relevant case note, by numbering them so that you can then cluster them together, group all the ones together to speak, number 2s together, number 3s, and number 4. This way, you save time. Your time management is well controlled and managed by you. You have the relevant case notes that you're extracting, and then it comes back to construction. How well are you constructing your letter, and how can it be in a sequential order where the reader immediately picks up what is this for, what has happened, what has been the outcome, and what are you asking me to do? Next. So from what I have just told you, in teaching you how to construct the letter, we say break it down. And here is an example of the structure. You focus on the purpose, the content, the recommendation, okay, which is your opening paragraph. Then in the body of the letter, understand the detail that is in the case note. That is so important because then only you'll be able to pick out and eliminate the irrelevant information. Okay, and then you will group the information in 1, 2, 3, 4, 5. You can use A, B, C, D if you want, whichever is easier. And then you will make sure that you understand the clinical setting of the case note and structure the letter in an orderly manner with the priority that the reader must understand and quickly at the glimpse get it. For so many doctors who are on here, you don't have time. You're seeing a lot of patients. So when you're reading a letter, a referral letter, you want to read and get the hang of that very quickly. At a glimpse of, oh, okay, this is a scenario. This is what's happened with the patient. And then you're then discussing that with the patient. You have a time to screenshot. Please take a photo of that to help you, and hoping that we're easing your anxiety for the upcoming exam or the future exam. And lastly, we also have another screenshot as to how you should construct that letter. What we suggest for you is please do not put any commas in the beginning of the address. You have your date, you have who you're addressing it to, and the subject, which is very important, okay? Now, if you look at that letter, the first paragraph tells you who it is, when did it happen, how did it happen, what has happened, what has taken place, and why am I writing this letter to the community nurse. In the body of the letter, it talks about the assessment, the outcome, what has taken place in the hospital, and the recovery. And the last paragraph is, what exactly are you asking me as a community health nurse to provide as home care services? Okay, and then yours sincerely to formally close the letter. Remember, informal language means that you will lose marks. You need to write the letter. Usually, it's always in formal language, but as in third person, because that formalizes the letter. Okay, next question. So let's look at the tips, guys. Genre and style. What is expected? Well, you have to be polite. You have to be non-judgmental. Judgmental. Now, for doctors, if I can come in there, if you are a specialist and you're writing the letter is always from a physician, a general practitioner, GP. Please do not write as a specialist because you can lose marks. Okay, so you need to make sure that you are writing in the way that you're not saying, I know that the patient has got this issue. No, you suspect the patient has that issue. That is why you are writing as and referring this patient to the specialist. The construction of the letter, you work out whether the patient knows the recipient, because if the patient, if that patient is known, they've already got a history of that patient. And again, sequence logically. You don't talk about little bits here, there, and everywhere in the letter. It doesn't come together when you're reading. You lose marks. So that's why we say cohesive and structure the letter in such a manner that it's easy to understand and readable. Next. And so just to look at the tips here, we've gone through all of them. And the last is the defining the purpose, which is all the 4 W's. Please take a screenshot. Okay, what are the traps? You can actually extract a lot of information that is not relevant. You can also, and another issue that doctors have is that they generally can write another case note to another case note. Please do not copy everything that is in that case note. This is a test of English. It's the ability to extract the information and write it from in your own words as to how the reader should understand that information. Do not provide too much of the background. And the questions that sometimes people ask me is that, oh, should I put the medications and the number of meals or number of times of the day? Times of the day is not relevant. Medications, you can name those medications if you want to. Yes, definitely. And remember, if that, for nurses, if that patient has come from the nursing home, you do not need to provide their history, because the nursing home is their residential care. They already have that. It's only what is prescribed when they were in the hospital. Okay? Avoid copying, as I've said, directly from the case note, and don't repeat phrases. So take a screenshot, because this can also be quite useful. Let's go into a bit of quiz here, and just 30 seconds. Which of the following is not an assessment criteria in the writing task? And which of the following is an inappropriate way to sign off your letter? I'll give you 30 seconds. Okay, Mercy, let's look at the answer. Active listening, fantastic, I've got that. And which of the following is an inappropriate way? Generally, the professional way is B. That's an appropriate way. Okay. Also, A can go, but you don't say thank you with all my love, because that is definitely not on. So both yours faithfully and yours sincerely is the appropriate manner. But generally what we say is, when you're professionalizing the letter, please make sure that yours sincerely is fine. That is the first option. Second, you can also write yours faithfully, but not with all my love. Thank you. Next one. And I would love to now hand this over back to Colin, my colleague back in Melbourne. Is there, before I go on, is there any questions from anyone? Thank you very much. Colin, over to you.
Thank you very much. I'd be interested to see the face of the examiner who received a letter, all my love. Maybe you get a better mark. No.
Absolutely.
Okay, let's talk about the speaking. Again, this is a really interesting OET specific task. It's like no other English language exam. It's important for you, though, to understand what it is you're being assessed on. Some people think one specific thing that I do wrong is going to make me fail the entire thing. And it doesn't work that way. There are linguistic criteria, 6 marks for each of those criteria, 24 in total for your mark. And then clinical communication criteria, 3 marks for each of those, and that's 15 in total. So doing the arithmetic, I'm not very mathematical, but that's 39 points available for you based on the criteria. Let's go into some detail on that. With linguistic criteria, what are we listening for? What are they listening for? Intelligibility means, can they understand you when you talk? Fluency, speaking without stopping. The appropriateness of language. If you're having a conversation with an elderly patient, are you using the right kind of language, for example? And then resources of grammar and expression. Okay, so each of those has its own score. All right, so you may do poorly on one and do very well on the others. Each of these has its own weight. And then with clinical communication criteria, we start with relationship building. This is about you as a medical person. Okay, building that relationship. And then gathering of information. How do you gather information? Do you do it well? Those open questions, for example. Giving of information. Next. Understanding and incorporating the patient's perspective. There is nothing worse, and I've been teaching OET for a very long time now. There is nothing worse than somebody who asks for information, if you're a candidate, hears the information and does nothing with it. It's like I'm, as the interlocutor, I'm talking into the void. Listen to what they've said and use that in the way that you move the conversation forward. Okay, demonstrate that you're not just a robot. And then providing structure. I think that speaks for itself. All right, moving on. Okay, the whole experience of OET speaking is a total of 21 minutes. That does seem very specific, so let's break it down. There are going to be 2 profession-specific role plays, and they are all based on a typical workplace situation. You will not be given anything which is going to be beyond your capacity as a medical professional, for nursing, for OT, for dentistry, for medicine, and so on. You start with a 3-minute warm-up, and in that time you can underline words, you can take notes, you can ask any questions of the interlocutor which are aimed at clarifying your doubts, things that you don't fully understand. All right, they're there to, they'll give you any input that they can in those 3 minutes. Once the role play starts, however, no. Next. What you've got to demonstrate is your ability to communicate proficiently, and those skills are going to come to the fore. Your ability to elicit information from the patient, that all important technique of using open questions, using indirect questions, because there's nothing worse than I ask a question, yes, I ask another question, no. That's not an interaction. That's you being a little bit two-dimensional. You need to show a bit of depth. How do you seek clarification? Don't just say, what? That's not seeking clarification. Find ways of eliciting the information to get that clarification from the patient. That's a very good use of your language. So you've got to be explaining to the patient the investigations that you're undertaking, the diagnosis that you've established, or perhaps the treatment that you'd like to carry out. Again, this is not just you directly giving information. This is interesting. Daljit spoke earlier about the context that you're going to be moving to. If you're taking the OET and your intention is to move to the US, to Australia, Britain, or somewhere else, the way that we interact with doctors is a little different. There are cultural differences. Offering reassurance, comforting an anxious patient, using your language and your tone of voice makes a huge difference. You are not robots, you are people, and most importantly, the patient's a person too. How do you provide advice, for example, on managing risk, on mitigating what has happened? All of these things are really important. You need to convey to the patient what it is that you know and what they need to know about their condition. It might be new information. And we've come back again to that idea of appropriate language. How old is your patient? You're not going to have a role play where the patient is 2 years old. That would be interesting and quite funny, but ultimately linguistically not very useful. You might be talking to the parent of a small child. You might be talking to the adult child of an elderly patient. But again, think carefully. Who am I talking to and how am I going to talk to them? All right. So let's look at actual role play card. You're going to see two role play cards about the same scenario. On the left, we have the role play card that the interlocutor can see. And on the right, we have the role play card that you as a candidate are going to see. If you've done practice with a friend or with content, with material around the place, you will often see that they make both role play cards available. It's a really interesting thing to do. I know that this is the Last-48, but if by any chance you have an opportunity to practice, this is a useful thing to do. Find two role play cards and get somebody to act as interlocutor, and you're the candidate. Now, let's go to the next slide and highlight something interesting. Okay, it is called function verbs. The first of which, no, it's okay. The first of which is highlighted here for you. Express is a function verb. You'll notice that we are looking now for the function verbs in the body of the tasks, both for the interlocutor and for the candidate. The first one's done for you. Take about 20 or 30 seconds, please, to find the rest of those function verbs. You don't need to write them in the chat box. Just find them and we'll talk about them in a moment. Okay, so let's have a look. Express, demand, express, ask, and accept. And then on the other side, under the candidate's card, explain, reassure, ask, suggest, confirm, explain, suggest. What's the important thing about this? It helps you to decide the way that you address each of those points, okay? So when it says suggest rechecking his vitals, what language am I going to use to suggest that action, okay? It does mean that you're not going to be giving a two-dimensional presentation of what this person's going to be doing in that scenario. You need to think about it. How do I use my language? What language am I going to use? Next slide. Tips and traps. I managed to say that quite well. Let's look at them. In the OET speaking, please make sure that you read the card and understand the gist or the main idea of what's going on in that scenario. It will not be obscure, but remember, you do have a little time when you read the role play card to ask any clarifying questions of the interlocutor. Some of the points can be clustered or grouped together. That means that you might actually bring them out or talk about them at the same time. But again, that's your call. The way that you do that, the way that you organize it's in your hands. The sequence of the conversation is also in your hands. The role play card has those bullet points. It is very helpful, but again, you have autonomy to make a decision as to what you consider to be the logical sequence. You've been a patient before, undoubtedly. You've been on the professional side before, no question. So again, use your experience to help you to do that. Try not to speak too quickly. I know that there is a tendency for some people to think the quicker I speak, the better they're going to think my command of English is. That's not the case, okay? So not down a few notches, don't be too quick, make sure that people understand what you're saying. And again, standard phrases like, do you understand? Do you understand? And repeating yourself, that can be terribly tedious to listen to. There are other ways of eliciting information rather than simply repeating, do you understand? Do you understand? Not the best, okay? And then traps. We've done the tips. Don't be robotic. Please try and sound conversational. You are a human talking to a human. Sounds like the Notting Hill line, but yes, you're just a guy talking to a girl. Here, don't be a robot. Try and connect with that person, with the interlocutor, with the patient. Find out their name in that warm-up time. How can I address you in this scenario? Could be that scenario implies that you've met the person before. If you've met them before, then you've got that established. And you don't need to finish every dot point. It's a 5-minute test, so you got 5 minutes. I don't want you to finish in 2 minutes. That's not the point. But if you're still talking at 5 minutes, that in itself is not a problem. Don't feel, I didn't finish all my dot points and it's 4 minutes 57 now. And no, that's not, that in itself is not the problem. Remember, we've talked about the criteria. Use those criteria to help you. Take a screenshot. Sorry, please take a screenshot. Let me be polite. Tips and traps. Okay, a little quiz for you. Can you answer these 2 questions? There are how many linguistic criteria worth a total of how many points? And number 2, which of the following should be avoided in the role play? Answers in the chat. Very good. There are 4 linguistic criteria worth 24 points, and you should avoid judgmental statements. That was touched on by Daljit in the writing too. Don't be judgmental. All right, you're not. They've not come to a priest. They've come to a medical professional. So treat it that way. Okay. Thank you very much. Moving on to my thank yous overall, and really do appreciate you being here with us for this last 48 hours webinar. We do them in the last 48 hours leading up to every single test. And the objective of this is to make you feel a little bit calmer, a little bit less anxious, and hopefully to address some of those items that maybe you possibly think you've forgotten about, you're not sure about, and you want to feel a little bit calmer about it going into the test itself. We have a post-webinar survey. If you would be so kind as to complete that for us, we'd be very, very grateful. It helps us. And this is how you can get hold of us. Again, there's no star in the corner, but if you've not already done so, maybe take a screenshot of this, find out how to get hold of Alex or Mercy at head office, and find out all sorts of information from our website. You could also use a phone. That's a funny way of doing things. Depending on your generation, apparently, I show my age by the fact that I make phone calls. Sending text messages apparently is the way to do it, or WhatsApps. Okay.
Okay, thank you, Colin, very much. And Mercy, thank you again. I do have a couple of people who've raised their hands, but can I just suggest if you can write those points in the chat box, and we'll definitely get back to you. It has been, quite a lot of you people have asked questions, so appreciate that. Colin, thank you very much from down under there, and I'll join you soon. And Mercy, again, thank you very much. And to Soumya and Sanjeevani, fantastic. Please give us your feedback. It's very important. And going into 2024, also wishing everybody a very Merry Christmas and a prosperous 24, and that all your dreams will be fulfilled and that you definitely pass OET. And we hope that we have been very helpful in helping you with not only just your anxiety of sitting the exam, but understanding the core elements or the skills of the exam. Thank you, everybody. And please don't hesitate to contact us. We'll be running the last 48 hours series right throughout every exam of OET. Thank you and good night.